The reason I'm very passionate about medicine is that I'm able to bring impact. In addition to that, it's forever learning and forever teaching. You are a teacher and a student for the rest of your life in this field. And I think that's very important for me. I always tell my wife or my kids that when we leave planet Earth, at minimum, people can look back and say, that person made a change. And I think that's what I strive to do, and that's the reason I love cardiology. I'm able to bring that same impact. My name is Sunmin Kim. I'm a structural and interventional cardiologist here at FirstHealth of the Carolinas. The biggest burden of disease in the field of cardiovascular medicine is heart failure. We have been able to provide a new technology over the past year called the transcatheter edge-to-edge repair. In fact, a lot of people know this as the MitraClip. That's the particular device. And this is where we're able to provide repair of a mitral leak or valvular leak in patients that were not good surgical candidates for open heart approach. Studies have shown that this particular therapy is superior than medicines alone. People feel better, stay out of the hospital, and are able to spend more quality time at home. And we've been able to do these procedures here locally, which really opens up the therapeutic options for our patients. It also means that they don't need to go to a larger academic tertiary center because we can give the same quality of care here at FirstHealth. From a structural heart standpoint, we are expanding beyond valves. We are treating not only aortic valves, mitral valves, but we're hoping to treat tricuspid valves. Aside from valvular problems, we're also dealing with congenital heart defects. We are closing holes that necessarily shouldn't be there. So there's certainly a lot of innovation in the field of structural heart disease. Now, from a coronary standpoint, where we look at the arteries that supply the heart muscle, there has been a lot of advancements. In fact, just last week, we performed our first coronary lithotripsy. This is where we deliver pulsatile shock waves to modify a heavily calcified lesion in the coronary artery that we were unable to or potentially had to send patients to even surgery for. Now we are able to use this new technology here at FirstHealth and provide the best care. Contrary to popular belief, actually, a lot of the landmark studies and clinical research occurs at a community level. A lot of these concepts that are studied at a larger institution or academic institution is actually implemented in a community setting. We're the ones who are actually providing that new technology, new medicine to our patients. That's where the biggest difference is, and that's what actually led me to be in a community center also, is that I'm able to be an early adopter. I'm also able to hone down on individualized care. Ultimately, I think the direction of all care or all medicine is going to individualized medicine. We are no longer just treating heart failure. We're no longer treating just coronary artery disease or a valve problem. We are treating you. We're treating a particular patient that has different anatomies, different response to medicines. So I believe that the future of cardiovascular medicine is heading towards individualizing care, whether it's through genetics, pharmacogenetics, whether it's through 3D remodeling, and advanced imaging. But we're trying to really dial in our therapies for each individual. So rather than using blanket medicines or blanket therapies or technologies, we're able to hone down on each patient because we have the necessary resources and the talent to give the best care for the community. The reason I love my job and love working at FirstHealth is I am a huge believer of we. I really try to put our team and our hospital and our community first rather than myself. And I think the ability and compassion to put others first is what makes a good physician.